What's up, beautiful people? Another day, another study, and I absolutely love studies like this, studies that compare lifestyle interventions to prescription medications. And this also has a special place in my heart because my grandfather diabetic, my dad diabetic, and so I really pay attention to studies on insulin resistance and diabetes and of course how we can prevent these things. But this study was in patients who were newly diagnosed, so they were diagnosed with diabetes within a year, and they did three different things. They had them do a 5-2 fasting group with a meal replacement. They had them take metformin, and they had them take another type of prescription medication. And then they followed them for 16 weeks, and then they looked at the results for cardiometabolic markers, weight, blood pressure, all these different markers. And they found that for reducing A1C, the 5-2 group was significantly better. They found that for reducing A1C below 7% and below 6.5%, the 5-2 intermittent fasting group with meal replacement was better than the prescription medications. They found a significant reduction in fasting glucose in the 5-2 group by 30.3. They also found that the 5-2 group had a better reduction in waist circumference, blood pressure, triglycerides, improvement in HDL-C, and more weight loss. So fantastic lifestyle intervention study for diabetes.